Our next panel is going to look again at a very specific issue about resilience. And that is a really important thing, which is something that every country has to do, namely it has to feed itself. And thanks to climate change, that is getting harder and harder, as we're going to find out in our next panel. We're going to talk about resilient food and health systems. And that's moderated by George Richards, who is director of Community Jameel, the organization that promotes science and learning around the world. Welcome all.
Thank you, James, and thank you, Fiona and Future Resilience Forum for this great conference and for hosting this panel. So I'm George from Community Jameel. We're an international organization advancing science and learning for communities to thrive, and joined the great privilege of chairing and moderating this panel discussion. And I'll just quickly introduce our panelists, and then we'll get stuck in. Immediate to my left is Professor Katharina Hauck, Professor of Health Economics at Imperial College London, and Deputy Director of the Jameel Institute, full name, the Abdulatif Jameel Institute for Disease and Emergency Analytics. Katharina and the team have advised governments through data modeling of outbreaks of infectious diseases, very busy, of course, during the pandemic, but also looking at chronic diseases and the intersection of climate change and health, which we'll speak about shortly. And I think today is the first episode of their new podcast, the Jameel Cast, so I recommend to download on whatever platform you get your podcasts from. Next to Katharina is Professor Geoff Simm, who is the director of the Global Academy of Agriculture and Food Systems at the University of Edinburgh and co-director of the Jameel Observatory, which is a program co-led by the University of Edinburgh and has a particular focus through one of its centers in Nairobi on climate change and food. Jane Burston, who is the CEO and founder of the Clean Air Fund, a philanthropic foundation tackling global air pollution, which she founded in 2019. Jane has also worked as a scientist in the British government and was head of energy and environment at the National Physical Laboratory. And next to Jane is Jean-Yves Ollivier, who is the president of the Brazzaville Foundation, a non-profit dedicated to peace, well-being, and sustainability in Africa. He was elevated by President Mandela to the highest honor order of Good Hope for his efforts in mediating the release of President Mandela. Worked widely in commodities and mediation and conflict resolution, particularly in Africa, and was recently described in the Financial Times, Czech's notes, as the cigar-chomping Kissinger behind Africa's mission to end the Ukraine war. And we will be joined, hopefully, by the Bangladeshi High Commissioner, who we hope is on her way currently. So, as James very kindly introduced, the purpose or the subject of this panel is really resilience to threats, including climate change, posed to well-being, particularly around food and health. And perhaps I will start with Katharina, since you're next to me. Maybe you could explain, please, a little bit about how climate change is affecting human health.
Yes, so I mean, there are estimates out there of the potential deaths between 2030 and 2050 yearly of additional deaths caused by climate change, and these are around 250,000 per year. These are mainly due to malnutrition, increase of malaria, and heat stress and diarrheal disease. Now, you might say, when you compare that with the major killers of this world, which are heart disease, 9 million, stroke, 6 million, you might think actually that's not so much, but I think there are 3 points why we have to see that in perspective. First, these deaths occur mainly in children. These are diseases of children, so more life years are lost than to cardiovascular diseases, which hits the elderly. And then, of course, it's the inequality that is associated with these deaths. the people who least contribute to climate change are those to suffer most in the global south, but also in disadvantaged communities in high-income countries. And then also what these deaths don't cover is the increase in pathogens, viruses that may cause future pandemics, but that also accelerate endemic diseases around the world. So we have seen cases of chikungunya, West Nile fever, malaria appearing on European shores. And then there's also research to suggest that due to climate change, the mammals, the animals, bats mainly, that carry viral disease congregate in elevated areas and are more likely to pass viruses across each other and then onto humans. So Jeremy Farrar, chief scientist of WHO, calls this the age of pandemics. And maybe we can talk a bit about what can we do in order to make our populations more resilient against these challenges.
Thank you, Katharina. Air pollution, Jane, is associated, I suppose, with greenhouse gas emissions in some way as a cause of climate change. But it also has an impact on human health, but also on food. Could you maybe shed a little bit more on that?
Yeah, absolutely. So air pollution is primarily from burning fossil fuels. So the same things that can solve for climate change oftentimes can solve for air pollution. And I think lots of people know it's bad for our health. Maybe people don't know quite how bad. It causes 7% of deaths every year. That's outdoor air pollution. And it also causes loads of chronic illnesses that people suffer from their whole lives. And the sorts of health impacts that we're beginning to hear about recently include things like Parkinson's disease, dementia, and very significant impacts on fertility, including up to 30% of miscarriages in some parts of the world are blamed on air pollution by the World Health Organization. And I think what people really don't know about is then the impact on the food system. It's quite circular because some air pollution is produced by the food system, ammonia from agriculture, and also in some parts of the world where crop stubble is burned in order to quickly then plant the next crop. But pollution really reduces crop yields. Just last year, it was the anniversary of the Great Smog in London. And so I was asked to write a book chapter about how did the Clean Air Act in the UK come about, what might other countries learn from this huge smog episode, but that then catalyzed all of this legislation that has reduced pollution in the UK. And what I found when I was digging around for interesting stories for this book was in Parliament when the MP who was introducing the legislation, the Clean Air Act, was pitching for it. He talked about an experiment that had been done, growing lettuces inside of London where all of the soot was falling on the crop, and then outside of London where the air was relatively clean. And the lettuces that were grown in London were only 44 grams. The lettuces that were grown outside of London, same weather conditions, 140 grams. So that's a kind of closer to home example of how soot can impact crop yields. There's other types of air pollution affect crop yields too, and I think then that has knock-on effects, obviously, on things like food security and migration, ultimately.
Thank you, Jane. And speaking about the effects of air pollution on food, we can also think about the impact of climate change on food. And Geoff, maybe you'd like to kick us off on that topic, please.
Sure. I mean, at this stage, probably the most apparent impact is to the increasing frequency of extreme events, so particularly droughts, floods, wildfires. As you mentioned in the introduction, George, the Jameel Observatory for Food Security Early Action, its work is focused in the Horn of Africa. We've seen the worst drought for 40 years there over the last 3 years. Some countries emerging from it, thankfully, others still not. So that's I think, a very vivid example of climate change. And that is affecting pastoralist communities in particular. These are people who herd livestock and follow livestock. It's one of the oldest forms of agrarian activity, people who do that are extraordinarily resilient, but finding it, I think, increasingly difficult to cope with the frequency of these shocks one after another. Longer range, we expect to see, well, actually, paradoxically, in the Northern Hemisphere, higher CO2 concentrations can boost crop yield, but in the warmer and drier parts of the world, where growing volumes of food matter most, the temperature and the lack of water are going to cause serious reductions in crop yields, and likewise, livestock are very susceptible to increases in temperature and humidity, so lower production in those countries too.
Thanks, Geoff. And we're hearing a lot about the particular vulnerabilities of certain countries and parts of the world to climate change and its impact on health and food. Jean-Yves, you've worked in many fragile and conflict-affected states, and I think that when we see that climate change is having an impact on health, there's an increased reliance on medicines. And the Fondation Brazzaville is looking at how to limit inflows of fake, falsified medicines into communities, particularly in Africa. And maybe you could speak a little bit about that as a sort of, maybe not immediately coming to mind, side effect of the impact of climate change on health.
To link the climate change to health is, of course, obvious. Regarding the problem of the fake medicine, it's quite, it will have also an effect. Fake medicine is an issue, a problem for Africa and other parts of the world, which is increasingly every day. Let's look a little bit about Africa. Africa imports 90% of its medicines. So any medication in Africa, 90% has been imported. They don't produce their own medicine, and the availability in Africa is terrible because of the price of the medicines. When you think that an antibiotic will cost about $3 and is 3 times what a family will earn per day, they are very much attracted by people offering similar medicines, we will cost 10 cents or 15 cents. So that leads us to maybe some figures. There is a clear estimation from the WHO that about 1 million people die in Africa only because they have used fake medicines. The last figure I received from 1922 is 125 children has died having taken fake medicine on malaria, 125,000. So we are talking about a huge amount of people who are dying because of that. But also, there is another factor, which is the fake medicines has created a criminal system, a criminal chain, which leads up to the terrorism in Africa. We estimate that today the terrorism in Africa is financed about 60–70% by the trafficking of fake medicines. Why? Because fake medicines, there is no law, or practically no law. If you import a container of fake antibiotic and you are going to kill I don't know how many people, the worst which will happen to you is your container will be seized by the custom and you will have a penalty because you have been importing irregular things. So there is practically no criminal law who punish this system. And so the criminals are encouraged to continue to increase their trafficking. one figure, the turnover of the fake medicines in Africa only is higher than the turnover of all the drugs in Africa and Europe, and with no risk. Of course, it's a very complicated thing. A lot of people have been looking at, and of course the major health organizations, but no one knows how to tackle this horrible system, because it has to be, the whole system has to be changed, and is what my foundation is trying to do through a pilot experience in Togo. We call it the Logo Initiative, the Lomé Initiative, and I must say that we are very happy that we are getting the support of most of the people, including the government, and we are going to look how, at the level of a country, we can tackle the tracking of the medicines, the judiciary, the corruption of the customs, how to do with the fake medicine when it says. We cannot burn it, because the pollution which will be out of a container of fake medicine is absolutely immense. So we need some special system to destroy them. So it's a long chain of action which we are trying to look at on a specific project, which is the Lomé Initiative.
Thank you, Jean-Yves. And Katharina, I know that you've also led research on falsified medicines. And climate change is, of course, one threat, but there's also weak governance and corruption, as you were describing, Jean-Yves. What do you see as some of the core drivers of falsified medicines, and how can we strengthen resilience in the face of it?
Yeah, so I'm not sure that I quite agree with falsified medicines being that there is a lot of evidence that it is a major public health concern. We actually at the Jameel Institute did a study in Indonesia where we sent out covert shoppers to collect 1,200 or so samples, even from very dodgy internet outlets. And what we found, and tested it in the laboratory, and what we found was that actually 5%, about 5% of samples were substandard, but just below the level that was required, so not going to kill anyone. We also did a study on how much it costs to collect these samples, and we found that just find one package of substandard medicine was like $5,000, $6,000, and that's in a country such as Indonesia, which has a lot of public health problems. So I think in a world where 4.5 billion people are still lacking access to essential services, where universal health coverage is far from being fulfilled as an SDG goal, I think investments in primary care, because that is the main tool to get to universal health coverage, I think is a best investment for the challenges, the public health challenges that face the world, particularly the global south.
Thank you, Katharina. Far be it from me to get in the way of a good row bubbling up, but the more observant of you will have noticed that Her Excellency, the Bangladeshi High Commissioner to Britain, has arrived. Thank you very much for joining us. Your Excellency, Saida Tasneem is the first woman to serve as Bangladesh's High Commissioner to the UK and Ambassador to Ireland and Liberia. As with the rest of our panel, or many of our panel, Her Excellency is a scientist, chemical engineer, turned career diplomat who has served in Thailand, Cambodia, and at the United Nations Economic and Social Commission for Asia and the Pacific, and was named as Diplomat of the Year by Diplomat magazine for her outstanding contribution to climate diplomacy, which is a perfect point on which to discuss challenges that Bangladesh especially faces, a very populous country, low-lying, battered by cyclones, And perhaps you could explain a little bit about the challenges that Bangladesh faces, particularly when it comes to the health of its citizens as impacted by climate change, and also maybe thinking about the coastal communities and the way that farming is often disrupted dramatically by cyclones and seawater incursions on crops.
Thank you. I'm just catching up my breath. I'm coming straight from the Labour conference. I just got off the train at Euston and straight to the Royal Old Navy College. Thank you very much. Well, first of all, I'd like to thank the Community Jameel for inviting me to Future of Resilience Forum. It's a great honor to speak here and to represent a country and to speak of the story of our people, 170 million people, the most climate densely populated country in the world and the 8th largest populous country in the world. That is, according to German Climate Watch Index, is the 7th most climatically vulnerable and high-risk countries in the world. So according to the IPCC 6 report, 19 districts, coastal districts of Bangladesh, we called a sinking coastline country, and 19 coastal districts in Bangladesh with 42 million people are under the threat of permanent inundation. So those coastal districts will be subject to more frequent and more ferocious cyclones, flooding, and of course global sea level rise. As we know, we're not being able to keep to 1.5 degrees, and therefore, before anything else, I'd like to inform everyone that we are fighting for climate justice, because it seems that, countries like Bangladesh, which had very little contribution to global temperature rise, our carbon footprint is between 0.4 to 0.5 per tons of carbon dioxide per capita, whereas we know that G20 countries, from a global south perspective, are responsible for nearly 85% of global emissions, and top 4 are responsible for 58% of global emissions. So we are the victim here, and currently Bangladesh has filed 2 cases along with small state commission at the ITLOS, International Tribunal for Law of the Sea, for advisory opinion, as well as at the ICJ, that whether temperature rise and emissions had caused global sea level rise, and if so, the second stage, whether countries such as Bangladesh should be compensated for that. And we know that at the COP28, the functionalization or the operationalization of the loss and damage fund will be a key issue at the COP28, where we were happy that it came into being in the COP27. So Bangladesh is going to be a strong voice at COP28 asking for that climate justice. Why? Because what are the potential damages that we're going to face? First of all, human security, and I know this forum looks into security. And, think about the 42 million people, where would they go? So there was the cyclone Amphan that happened to Bangladesh during COVID. It was a Category 5 cyclone, and the first resilience that we've developed is to move people from cyclones. It had cost us, our economy, $5 billion, but we didn't let a single person die. So that is the resilience we've developed. We moved 2.4 million people in the coastal areas, absolute extreme coast, to safety, because we have built 12,000 cyclone shelters for them. But however, it did cost us $5 billion. So we are having a GDP loss of 2% due to climate change each year, and by the turn of the century, by 2070, it'll be 9%. Our rice production currently is affected by about 2% a year loss, but by 2050, it'll be 8% loss of our agricultural rice production. Our wheat production will be lost by 32% by 2050 if the current sea level rise continues. So few of the threats to our coastal areas, number one is salinity intrusion. So because of sea level rise, we have saline water and we cannot produce anything there. But we are producing, and that's the resilience we will be talking about. And then number 2 is drought in the northern area, and too much overproduction of crops has caused arsenic infections, too much arsenic in the ground level, so water level has gone down, and we do have health risk from the arsenic. We do have floods every year. We just had Sylhet floods. As you know, that the diaspora here, about 800,000, British Bangladeshi diaspora, most of them are from Sylhet. And Sylhet saw a very, very bad flood, just last year. And, different countries come up with support, including the United Kingdom, but we have learned to live with it and also try to be more resilient to floods. So there are health-related risks from floods. The other health-related risk is, because of Bangladesh is in the earthquake, active earthquake tectonic plates at the Himalayan foothills, we also have very frequent tremors in Dhaka city, and sometimes small installations and old installations do fall down. So, some of the health-related risks are currently, SDG 2, and we were talking about Sustainable Development Goals, and we do take SDG 2 and SDG 3 very seriously, because SDG 3 depends on SDG 2. Health security and well-being for all depends on your end of hunger, nutrition, and sustainable agriculture by 2030. And that is why our country have taken such, we have become from a food deficit country to a crop resilient and crop, we have now, we're exporting rice. Currently, Bangladesh is the third largest rice producing country in the world, third largest fish producing country in the world, third largest vegetable producing country in the world, fifth largest potato producing country in the world, and also fifth largest mango producing country in the world. But how did we do it? Think about it. Every single square meter of land matters to us because we are so densely populated. On top of that, we have 1.3 million Rohingyas now that we are hosting in the coastal areas. So I don't know if this is my only slot, but I'd like to talk about a few innovations that we've done. If I have another slot, then I can tell you.
Maybe we'll come back to that if I may
Thank you.
Excellency. But just because I wanted to pick up on the point about climate justice, and maybe looking at Jane, Geoff, when we talk about, for example, reducing air pollution, how can we find ways which are just for countries which are rapidly industrializing and see the need to build factories, which of course does lead to increased pollutants? How do we square that circle? And then maybe turning to you, Geoff, after Jane, similar question around particularly livestock agriculture. And you're talking about pastoralists who are herding cattle, but then we also hear about the unglamorous bovine flatulence issue as a methane emitter. And there's a lot of pressure now on livestock farming from a climate mitigation perspective. So maybe, Jane, to turn to you first to talk a little bit about just transition and climate justice.
Thanks. So I think the first thing is to provide the finance where it's needed the most. We look into every year the state of financial flows to air pollution. And what we've seen this year, looking at 2021 data, is that there's only 1% of international aid is going to fix air pollution, even though it tackles both the health and the climate issues that we're facing. And of that 1%, only 5% goes to Africa, for example. 86% is spent in just 5 Asian countries. So the aid isn't evenly distributed at all, especially considering where air pollution is likely to be increasing the most and the ability to tackle some of the problems before they start in some of the very rapidly urbanizing cities and rural areas. I think the second thing is to recognize the economic development potential of some of the, of fixing air pollution in general and then of some of the interventions. So overall, because air pollution affects our health so badly, it's a huge cost to the health system. And what's not often included in these economic calculations is it has a really big impact on productivity. If kids are being born with smaller brains, which they are because the air pollution is so high, and then on certain days or weeks they can't go to school because the schools are closed down, and then when they're, because of air pollution, it's not safe to go outside, and then when they're of working age, their productivity is lower because both on high air pollution days you can't concentrate, but also you can't go to work if you're sick. There are really huge productivity costs. There was a report done looking at this for India, just literally the cost to productivity, and it said in India that's 3% of GDP. So we can solve a lot of problems by fixing this issue. Secondly, on economic development, I think there are a number of interventions that you can make that are beneficial for livelihoods as well. and we talked a little bit about crop stubble burning earlier. There's quite a few solutions to the use of that agricultural material that are great for livelihoods. So we can pay the farmers to harvest that, reuse it for either products or biomass to be burned instead of coal in generators for these manufacturing facilities, and create the kind of circularity and increase in funding to farmers and also additional jobs that transporting this waste biomass produces to increase individuals' prosperity as well.
Great, thank you. Solutions, this is great. Geoff, maybe you'd like to talk about, yeah, as we were saying, the balancing act that has to be struck between the emissions from herds of cattle and the threats that pastoralists face from climate change.
I think probably a different set of approaches in richer and less rich countries. I think in countries that are already consuming large amounts of livestock products, there's changes in behavior needed to reduce consumption, but also some exciting technological developments to reduce methane emissions. So dietary supplements, breeding for low methane emissions are probably two of the most promising technologies that well, in late stage trials or being applied in some cases. In countries such as those in Africa, where pastoralists depend absolutely on livestock, there aren't alternatives for them. But I think actually reducing losses of those livestock, improving productivity are two ways of reducing the emissions intensity, the carbon production per unit of product. That's complicated because those animals have huge cultural significance as well. They're not simply a food source. So the numbers of animals kept and the way they're kept has huge cultural importance as well as simply being a food source. But there are ways both in the north and the south that we can tackle these issues, and many of those being implemented now.
Thank you. Jean-Yves, tackling a global threat like climate change requires coordination between states. And one of your foundation's activities involves coordination at the diplomatic level between different governments. Could you speak maybe to how, particularly in Africa, there are efforts, or there could be more efforts, to improve coordination in response to threats posed by climate change, whether food, health, or simply trying to manage other aspects of the crisis?
That's a very difficult question to answer. How to improve a situation which has been there for such a long time and people seem not to be so interested. One of the problems, of course, it's a global problem, I believe. It's a problem of how the South should be looked by the North. What has to be changed? Like North institutions, the IMF, the World Bank, the Security Council, which ignores completely Africa and was been built at a time which is not the time of today. So yes, there is a necessity to have a better dialogues between the South and the North. As President Macky Sall said yesterday, we have to look at the future with the South as partners and accept the fact that we will not be, the North will not anymore be the leading party and will decide what the South should do. This is a long exercise, but I think with the willingness of the parties, it will be achieved. Anyway, one thing is certain, is that in Africa today there is one word which prevails: sovereignty. Today, the countries of Africa does not accept anymore to be under the control, the guidance of the North. And they are looking for another alternative, another issue. And I believe that it's time for the North now to accept the fact that the way we work and the way we function is not anymore the way the world of today, where the world of today should prevail. So this is just a general feeling. Of course, it's very large, and we are trying to help in this concept and perceptions.
Thank you, Jean-Yves. And in the health domain, the Jameel Institute works with many governments around the world to provide data modeling and advice on pandemic preparedness, pandemic response, and managing other disease threats. Do you see that there's more that needs to be done to improve coordination between governments and health institutions in tackling the health challenges, particularly as posed by climate change?
Yes, so I think, we saw during the pandemic that unfortunately the cooperation between countries was not there. In the face of the emergency, many countries became very inward-looking. Initiatives such as COVAX, vaccine sharing agreements, did not reach the level that many countries wished. But there are very positive examples. For example, the East African nations got together and shared data about test results of truck drivers and exchanged this data among each other. They founded a network to tackle the crisis together very early on, when our governments in the global north were still debating and not quite understanding what was coming towards them. I think there are now efforts to change that. There is the Pandem 2 initiative from the European Commission, data sharing agreements, platforms that allow the quick exchange and providing information to governments to make good decisions. I think when we consider emergencies such as pandemics, we have to accept that at the end of the day, we cannot often prepare for the really worst case, because the costs of holding surge capacity, the costs of holding vast stockpiles of vaccines, of treatments, are very high. So the evidence that we often present to policymakers is what does the stockpile, for example, of an Ebola vaccine have to be to deal with 95% of outbreaks that may hit you, or with 90%. Unfortunately, the last 5% we have to accept that there are pressing priorities today as well that we invest in. Budgets are limited.
Thank you, Katharina. Your Excellency, looking at Bangladesh, you said that Bangladesh is adapting. It is demonstrating resilience in the face of climate change. Maybe you could highlight a couple of examples of how Bangladesh is managing climate change and lessons that can be valuable for all of us around the world.
Thank you. I did showcase my country's agricultural sustainability in the face of climate vulnerability. What we have is, first, a country must have a plan. So we have set up our National Climate Adaptation Plan in 2009, right after coming back from Copenhagen. Our Prime Minister, we call it the Sheikh Hasina model, that has given us so much independence and prosperity. And our food production grew from 32 million to nearly 60 million food production, which is, agriculture sector is 12% of our economy. It's a very critical sector. It employs 42% of our population, and mostly women. So women really contribute. It does matter. There's a gender perspective to it. So, we have a plan, and then number two is that we have a Mujib Climate Prosperity Plan. Our target is, we know that we are going underwater, but we cannot allow it. So we're trying to make our coastal areas much more resilient by 16.5 kilometers of the coastal area has got extra dikes. We've got a Delta Plan 2100 with the Netherlands, because Bangladesh and Netherlands have similar topography in the coastal areas. And according to that, we're building dikes, and we built 12,000 cyclone shelter, not to allow any human being, human lives for any coastal disasters. But we can quickly move them. So this is a natural disaster preparation innovation that Bangladesh has invented, and it is followed globally by the UN, humanitarian agency. Second is, according to our plan, we need financing. So, we know that the 100 billion isn't coming anywhere. We have created our own climate trust fund because we can't wait for somebody else to come and save you. You have to save yourself. So for us, it's a matter of survival. And Bangladesh was the chair of the Climate Vulnerable Forum, which is a forum of 56 most climatically vulnerable countries, including from Africa, but mostly from Asia, small island developing countries, and countries such as Bangladesh with coastal inundation. So we have created the Mujib Climate Prosperity Plan that every CVF country has adopted. It's a plan for making yourself climate resilient and then aim for prosperity. That means you must have a high growth country, but with a climate resilient plan. According to that, agriculture is the #1 sector. And currently, every country that will be inundated according to IPCC report, we are recommending in Africa in particular, and small island developing countries, our agriculture sustainability plan that we have invented 690 varieties of climate resilient crops, including salinity resilient crop, including drought resilient crop, including submersion resilient crop, because we have low-lying areas. And these crops give us, we give the seeds free to the farmers, so incentives to the farmers is extremely important. We have biofertilizer production, and that's also important, but we have very less because of our lack of agricultural land. But there should be global supply chain biofertilizer production, and we should be able to procure it at an affordable price for our farmers. We also have, the other innovation is that for our forests, we're going to plant 30 million trees. We already, we have the mangrove forest that Bangladesh and India shares, the Sundarbans. But mangrove is a great way of making your coastal areas resilient. So we are planting new mangrove trees, encouraging other coastal countries in our region to plant mangrove trees, because if you have a mangrove coastline continuation, even like tidal bores can't hit you. You're resilient. So financing is very important, and I think somebody mentioned about it. But we look towards multinational banks, and the private sector, engaging the private sector in the agricultural sector is extremely important, and the health sector, because there's a strong private sector health industry growing there. And, Bill Gates Foundation, they invest in Bangladesh. Now the Alibaba is investing in health sector in Bangladesh. But these multinational big names, philanthropies such as Jameel Foundation. But by the way, we want to invite Jameel Foundation to work in Bangladesh. I saw you work in India and other countries, but you must come to Bangladesh as well. It's a country worth investing in. And so number 3 is, private sector financing, philanthropies to get involved. Number 4 is that, I have another recommendation. Oh yes, nature-based solutions. We have floating agriculture. This is an ancient way of farming on water hyacinth. So you can grow anything on that. So we've had floods, I think, traditionally, historically. So we've built this in coastal and low marshy areas. The FAO has called World Heritage, Climate Heritage Farming. So we encourage other countries to follow that. In fact, with the Princess Foundation, we're sharing this technology. And the other recommendation in climate innovation would be use of technology. We look towards, in a global partnership, SDG 17, we know that funding isn't coming, including even Rohingya funding has gone down considerably. It has slashed down to about 10% of what it was in 2019. After COVID and the Ukraine-Russia war, that has really, really slashed down food security, fuel security, and fertilizer. And fertilizer is a major security you need in fertilizer. So we must have a global supply chain of fertilizer open for countries such as Bangladesh, so that, we are agriculture self-sufficient, but we need transfer of nanotechnology, bioinformatics, and other advanced technologies. Extremely important that rich countries share these technologies and research with us. So research partnership is extremely important. And last is, we are encouraging our young people to look into food wastage, because I think food wastage is a big issue and creating awareness. So right now, there's a program called the Smart for the young people in Bangladesh. It's called Smart Agriculture. So, we encourage them to grow on the rooftop. So every rooftop has growing some kind of organic vegetable. At the same time, we ask them to do city social campaigns for prevention of food wastage. And how much food is wasted in the world? It's in trillions of worth of US dollars. I mean, equivalent to an armory industry, which we discourage. But you know, before ending, we want to say that every country can be climate resilient if they want to do it. Our carbon footprint is very low, but we urge the major emitters to really, really look into the ICJ case, because we are not going to give them any what can I say, pardon there, because they have emitted this world, and our climate justice voice will be very strong. And before ending, I'd like to pay my condolences and sympathies to people who were victims to the recent, terrorist attack in Gaza Strip, both on the Israeli side and on the Palestinian side. Thank you.
Thank you, Excellency. And, well, perfect timing. We're time to wrap up. I think a lot of the discussion today will be continued, no doubt, in Dubai at COP28 at the end of November, beginning of December. It's the first time there's going to be a health day, dedicated health day in the COP calendar. Food and food systems are very prominent in the agenda of the COP28 presidency of the UAE. So I'm sure many of the themes that we've been discussing today will be picked up then again. A round of applause for you for the panel. Thank you very much.